to introduce Dr. Cynthia Clark, and I assure you tonight's meetup will be incredibly interesting. So Dr. Cynthia Clark is founder of Civility Matters, professor emeritus at Boise State University, and an award-winning professor, scholar, and author. She serves as a fellow in the American Academy of Nursing, the NLN Academy of Nursing Education, and co-chaired the American Nurses Association professional panel on incivility, bullying, and workplace violence. Dr. Clark is best known for her groundbreaking work on fostering civility and healthy work and learning environments around the globe. Her theory-driven interventions, empirical measurements, theoretical models, and reflective assessments provide best practice to prevent, measure, and address incivility to create a healthy, productive workplace. Dr. Clark is the recipient of numerous teaching, service, and research awards and widely acclaimed for her engaging presentations. Her empirical assessments have been translated into 16 world languages and used by scholars in 32 countries on 5 continents. Incredible. Her book, Creating and Sustaining Civility in Nursing Education, received first place honors as AJN Book of the Year. Her new book, Core Competencies of Civility in Nursing and Healthcare, is a must-read for all nurses and healthcare professionals. Dr. Clark is a policymaker, community builder, and unwavering advocate for a kinder, gentler, and more civil world. She and her husband are the parents of 3 successful young adults and the blissful owners of a motley crew of rescue pets. And I'm honored and welcome Dr. Clark.
Oh, thank you. Oh gosh, greetings everybody. Welcome wherever you are right now. Thank you for joining us tonight. Such a privilege to be with you. I've really been looking forward to our time together. And Kim, thank you for the kind introduction. Nico, you're a rock star. Thank you for all of your support and expertise. And thank you to the sponsors who are making tonight possible and for inviting me to be part of this event. So it's really an honor. And to be able to have these kinds of discussions about this important topic, what I believe all of us believe is an important topic around civility and creating healthy work environments, really comes at a critical time. And as we'll discuss a little bit later, the research and evidence that's really emerging, as many of you probably know, you're probably reading that kind of evidence, is that evidence is around improving our workplaces and our work cultures is something that so many businesses and organizations are really laser focused on, and that we're really paying attention to our personal, our professional, as well as our organizational well-being. So thank you again for being here today, for all the things that you are doing, the contributions that you are making, because I know what you do is really a heavy lift. And to meet those challenges, I just want you to know how much that is appreciated by so many. So thank you very much. So I'm going to ask if we can put my slides up, Nico, and we'll get started. So today's, or this evening, wherever you are in the world, the title of today's session is called Civility Matters, How to Foster a Healthy Work Environment. And so as the slides are coming up, we'll go to the, I'll take control of those. Let me just have a minute. Takes a second in the cyber world for that to happen. Okay, Nico, I'm taking control. Okay, so here's what I'm hoping that we'll spend some time with over the next hour-ish or less that we have together. The first thing I'd like to do is just sort of briefly describe or give some definition or context to some of the concepts and constructs we're talking about. What do we mean by civility, incivility, other forms of workplace aggressions? So we'll just sort of do some level setting that we have a foundation for this session. And sometime around the midpoint, but during this session, I'm going to lead us through and facilitate a reflective activity for you to assess your own perceived level of civility acumen. In other words, how might I be coming across to other people? How might our interactions or our behaviors be influencing those around us, including our teams and our organizations? In the introduction, there was mentioned some of the work that I've done, written about recently, where I really like to look at what are the individual competencies that each of us can do and each of us can bring to the table. For tonight's purposes, because our time is short, I'm going to be focusing on organizational strategies. So sort of system wide or structural things that we can do within our workplaces to create healthy work environments. So let's see if I can, there we go. So what I'd like to do is I'm gonna read this quote, but I want you to sort of think about it. And it comes from P.M. Forney, and maybe you're familiar with his work. P.M. Forney is now passed on, but for many, many years, he was the director of the Civility Project at Johns Hopkins University. He's written some wonderful books. This particular quote comes from a book published back over 20 years ago in 2002, still so relevant today. And one of the quotes out of his work was that a crucial measure of our success in life is the way we treat one another every day of our lives. And as I reflect on this quote, and maybe as you do, at least how it speaks to me is that no matter how crazy things get, no matter how stressful, no matter how many changes we might be experiencing or going through, no matter how much things might feel out of control, that there is something that we have some control over, and that's how we treat one another and interact with one another. And certainly I know that that's not always easy. And the human condition often is that we find ourselves responding in ways that maybe we might not otherwise respond if things were a little less stressful. So we'll talk about some of those things. So I want to start with just a few of the concepts that I mentioned. And the first one is, what is civility? And if you'd like to read on this topic, you might grab that QR code. This is a publication that my research team and I just published in Nursing Outlook about a year ago. And what we were doing with that particular article is completing a second or a revisited concept analysis on what do we mean by civility. Because back in 2008, a colleague and I had published the first concept analysis on civility, but once COVID came along and the world just sort of shifted in so many different ways, I really wondered, what do we know about this concept? How does it, what are its antecedents? What are its attributes and so on? So just being very curious about that, I assembled a research team and we redid the concept analysis of civility. And I won't go into it all because it's very complex. As you know, some of you have probably completed concept analyses. But what we found, and what often grows out of a concept analysis, depending on the model or the framework you're using, is what is the operational definition? What does it even mean? And so what we found in reading from multi disciplines, from papers and scholars all over the world. So we were really intrigued by how much this topic has grown. And so what we learned is that what civility really is it's a choice. We choose to engage in a respectful and inclusive manner. And we do that because we want to have some intention around building relationships, cultures of belonging, meaningful connections, and in particular, possibly, especially during times when we disagree. So ultimately, civility is a choice. It's a decision we make every single day with every encounter, with every interaction, and it's showing the respect and dignity and respect and dignity for that well-being of each person, and valuing and having them be seen and heard and valued. And one of the things I like to say when I'm talking about civility and defining that is that civility is not about liking. In other words, we don't have to like someone to be civil and respectful, to extend that dignity. If we work together, if you and I work together and we like each other, that's awesome and that's a bonus, but it's not requisite to us being able to have the kind of respectful communication that we want to have. And so when you think about your workplaces, and if they were to be exemplars for a civil, productive, thriving culture, you would see things like people collaborating, being collegial, working well as a high functioning team, treating one another with respect and in a professional way, and stepping up, serving on committees, taking collective responsibility for the work that needs to be done, and having that sort of welcoming milieu and organizational support. We would see psychological safety and trustworthiness. So those are the things that we'll be talking about in a little bit. How do you capture that through what I'll sort of unfold for you is what I call the pathway for fostering organizational civility. But before we do that, I want to turn the basket upside down for a moment and talk about, if that's civility, what do we really mean by incivility and other workplace aggressions, and how do they manifest within our workplaces? And really, so much of what we're talking about today has implications just for life. You know, how we are with our neighbors, our friends, our family. But tonight our focus is really that workplace. So what might that look like? And I won't take us through this entire continuum, but I wanted to provide a visual of something that actually was originally constructed. I developed this continuum. It used to be called the continuum of civility, which I never really liked, because once you get out of the incivility territory, you're really talking about something else. So in 2021, I revised the continuum and renamed it the Continuum of Workplace Aggression. So when we're looking at this, the way to sort of view this continuum is like any other continuum, that on the left side of the continuum, in this case, you would have what we would consider sort of lower level forms of aggression, like maybe things that are annoying or irritating. And then to the right side of the continuum, certainly higher levels, more aggressive and hostility and so forth. And so if we go back to that left side for just a moment, and we see things like nonverbals, which are always interesting because we think of them as not being the most aggressive forms of a hostile work environment, if one exists. But when we really think about it, things like eye rolling and finger pointing and door slamming and arm waving, or a paper that was written by a group of physicians that was just really interesting, talking about what are the disruptive behaviors that were happening in a series of hospitals that they studied this. And what they found is one of the most oppressive or aggressive forms of workplace behavior in a nonverbal was just simply walking away before a conversation is over. And we get that as healthcare providers. You know, if I have a struggle with my neighbor or a conflict with my neighbor, and I walk away from that conversation, maybe that's a rude gesture, but nobody's going to get hurt. Nobody's going to be harmed, hopefully. But in the patient care areas, that certainly could happen, because it shuts down that communication that is oh so important. And as we move along this continuum, we're seeing things like microaggressions, or more overt examples of workplace aggressions, like spreading rumors, negative gossip, pitting colleagues against one another. I don't know if we have any academic colleagues on the line tonight, but in an academic environment, a school of nursing, for example, pitting students against various faculty and faculty struggles. So whether we're talking an academic or a practice environment or any work environment, really, things like name calling, making demeaning or belittling remarks, put downs, posting insults on digital or social media websites. And I also want to mention here that incivility, at that left side, if you will, is not only what we do, but what we don't do, or any of these. For example, I mentioned the article that talked about walking away from a conversation before it's over. So when we stay silent, when we don't speak up, when we fail to acknowledge or support a coworker, or when we marginalize or ignore others, or we withhold vital information, as I said a moment ago, especially in the patient care areas, it can literally mean the difference between life and death. And so just a couple more thoughts on the continuum before we move on. But thinking about bullying, and there's lots of definitions for bullying. The one that I tend to resonate most with is bullying being described or defined as a repeated, persistent pattern of abusive behavior. It's characterized not always, but almost always, by a power over, that power differential, whether it's perceived or real, often with an intention, though none of these sometimes are intentional. And that's hard for us to sort of grasp, that people could behave badly and it's not their intent, or they're clueless about how they're coming across, which is why we're going to do the civility index to sort of give you an example of what I'm talking about. And it's interesting, I'm right in the middle now. I'm coming toward the end of a paper that I'm going to be submitting for publication on gaslighting in nursing, particularly in this case, nursing academe, and gaslighting being a sort of subtle and covert and very diabolical, really, way of treating people, where a gaslighter, if they're really good at it, they're going to distort the truth or rewrite reality or sow those seeds of confusion, so that we end up questioning our own memory, our own thoughts, our own beliefs. And sometimes, to the extent, if they're really good, we might even believe the gaslighter over our own belief system. And there's so much more on this continuum, but I know our time is short, so I'm going to go on and have a moment to focus on a couple of other things. So very often people will say, well, why is this happening? What are the stressors or the contributors or the factors that contribute to incivility and these other kinds of behaviors? And the literature is pretty clear. I mean, there are multiple factors, obviously, but stress tends to be way at the top, whether it's personal stress, organizational stress, all those kind of stressors come to bear. And if you think about it, when we're really stressed out, we are more likely to behave in ways we might not otherwise behave, because we're just, really under an incredible amount of stress. And so for me, and by the way, it wasn't in my bio in the intro, but my background is behavioral health. So a less emphasis on stress and more emphasis on mitigating that stress and finding ways to cope more effectively with our stressors, because goodness knows, if you're in the business of healthcare, I used to say to my students, and I say to my daughter and my daughter-in-law, who are both nurses, if you're a nurse, you chose stress. You chose it. And so you see all these other things here that might contribute to us behaving in ways we might not otherwise behave. And I'm often asked, well, what keeps people from speaking up? Why do they avoid dealing with incivility? And pretty much at the top is this idea of fear of retaliation, whether that's personal or professional retaliation. Sometimes in my own studies, sadly, I've also in a national study that my team and I just completed and published a couple of years ago, we also saw that right side of the continuum that I showed you with actual threats of violence. In one story, a respondent spoke about being threatened by a colleague who said that they were going to find her in the parking lot and run her over with their car. So we see many reasons why folks don't always address it. There's generally more than one reason, but one of the ones that I have found that where I spend a lot of my time is that people don't know how. They haven't, this isn't something that comes naturally or we just know. It takes a lot of practice for us to be able to learn these kinds of things. And so when we think about the detrimental impact, I'm trying to go forward and it's not letting me. Let me see if I go that way. When we think about the impact of these kinds of behaviors, we see things all the way from just being exhausted to, you've heard the term quiet quitting, to absenteeism, to people resigning, impaired relationships, all of these kinds of things on our personal and, professional life. But when we think about it in terms of patient safety issues, the literature is very clear. The link between incivility and poor patient outcomes is now very well documented. Maybe some of you have even written on the topic, all the way from minor issues to life-threatening mistakes and adverse events, near misses, all kinds of things that can happen. And in our teams, we see, even on the individual healthcare professional, it diminishes our ability or impairs our ability to think, with clear clinical judgment. It impairs our performance. It heightens moral distress and burnout. I mean, all of this, so much that's been in the headlines for a long time now, is highly associated and related to some of the things that we're talking about tonight. So I wanted to spend just a second on some rationale, and then I'm going to lead us through the civility index. So get ready for that, and let's spend just a moment on rationale, because I thought you might be interested. If you're, and you're probably aware, if you aren't, you can go onto the website, and this is just like this much rationale. We could do hours. We could do a day-long workshop on rationale of why this is important in the groups that are studying this. But if you go on the website in our country, and I know we have folks from outside the United States, but the United States Surgeon General has made workplace well-being a top priority. Here's their model. They're suggesting that we need to focus on 5 essentials for workplace mental health and well-being. And you can notice there that, as I think about it, at least from my lens of civility and healthy work environment, is that it interfaces with all of those, especially I think that mattering at work, that protection from harm, because that includes psychological distress and psychological harm as well. So all of these help make meaning for me in terms of tonight's conversation. And I know you're probably very well aware of the National Plan for Health, Workforce Wellbeing, and then the MIT Sloan Management Report. And I won't read all of that, but as far as the national plan goes, their top priority is the one that I've listed there. And that's why I'm so passionate about this topic, is because they have identified that for us to have workforce well-being, we really need to create and sustain positive work and learning environments and so on. So let's go ahead and talk about that a little bit. And I mentioned that I like to think about the core competencies of civility in this idea of individual as well as organizational. And I mentioned that we'll be focusing on organizational, but I want to take a moment to focus on at least one of the individual core competencies, because I think it's so incredibly important. And that is that we really need to be honing and deepening our levels of emotional intelligence, particularly in the domain of self-awareness. Certainly all domains matter, but I want to take us into that territory of self-awareness. And I don't know if I have any friends on the line from the state of Washington, but that's at Mount Rainier, where we were doing some hiking at one of the glaciers at Mildred Point. So that's what that is. But I love this quote that comes from Veronica Tugaleva, who said, "To know yourself, you must sacrifice the illusion that you already do." So in other words, I'm going to show you a graph here in a moment. Some of you may be familiar with the Civility in America report. It was first conducted, the first Civility in America report was conducted in 2010. And it's been conducted every year since, though there were a couple of years that were missed around COVID, which would have been really awesome to get that data. But there were reasons I'm not sure of why there weren't always data collected at that time. But each year that they collect data, it's the same research group, a very well-known and highly regarded research group. Every year that they study this, it's a little bit different. So I want to show you just one graph out of the 2017 data set. It's really interesting to me because what they were asking here on this 5-point Likert scale is for respondents to weigh in or rate themselves, their coworkers, and so on, and all the way to other people in the United States. You can see it and read it there. And what was so striking to me is that when people evaluated or rated themselves as individuals, you see it's well into the 90th percentile, 94%. But when we rate our coworkers, or those in our workplaces, we see what I think is a pretty significant 21-point difference between self and coworkers. So it illustrated again what many scholars have written about, which is we have a very different opinion of ourselves often than people have of us. So that led me years ago. I think it was back in 2009 or something like that, where I created the Workplace Civility Index. And so I'm going to lead us through that. And generally, the way that the Civility Index is actually scored is that it's also on a 5-point Likert scale. Because our time is short tonight, rather than a 5-point Likert scale, I'm going to ask you for each item, there are 20, I'm going to put 10 on one slide, 10 on the other. As I read through them, rather than a 5-point Likert scale, I'd like you to just do a binary response of yes or no, recognizing, of course, that that's not really going to be as accurate as it would be if we had that scale, but it'll give us kind of a ballpark to think about. And then I want you to keep score. Every time you say yes, okay, 20 items, every time you say yes, make a mark or keep track, count on your fingers and toes, whatever. But keep track of your yeses, because at the end I'll give you a ballpark score. It certainly won't be super accurate, but it'll give you a sense. One more thing, because none of us are perfect, certainly I'm not, I'm going to use this stem. Do you 90% of the time or more, yes or no? Okay, everybody got it? Everybody ready? So keep score. Here we go. Do you 90% of the time or more assume goodwill and think the best of others? Do you include and welcome new and current colleagues? Do you communicate respectfully via email, online, phone, face-to-face, and really listen? Do you avoid gossip and spreading rumors? Do you keep confidences and respect others' privacy? Do you encourage and mentor others? Do you avoid abusing your position or authority? Do you use respectful language, no racial, ethnic, sexual, age, religiously biased terms? Do you attend meetings, arrive on time, participate, volunteer, and share the work? Do you avoid distracting others, like misusing media or having side conversations during meetings? Do you avoid taking credit for someone else's ideas, work, or contributions? Do you acknowledge others and praise their ideas, work, and contributions? Do you take personal responsibility and accountability for your actions? Do you speak directly to the person with whom you have an issue? Do you share pertinent or important information with others? Do you uphold the vision, mission, and values of your organization? Do you seek and encourage constructive feedback from others? Do you demonstrate approachability, flexibility, and openness to other points of view? Do you bring your A game and a strong ethic to your workplace? And do you apologize and mean it when the situation calls for it? So, okay, count up your yeses. And I'm going to go to the next slide. And again, it's just a ballpark, but here you go. And so at this point, what I'd like you to do is either, I don't want to know your score or anything like that. That's your personal business. But I would love to know, either by having you chat in or turn on your mic, to just say, tell us, what was it like? What was that experience like for you to sort of do this reflection on your own behaviors? So anyone want to get us started with that? And I think Nico's going to check the chat. So anyone have any thoughts they'd like to impart?
I was nervous doing it. I wanted to get a good score, so I was really making, I was like, oh my God, I hope I do that. I hope I do that.
Thanks. Other experiences or thoughts?
I think it's hard to say that you're going to do it 100% all the time. And, I think you can trace back and say, oh, I remember when I didn't do that. You want to think that you do those most of the time, but you know that sometimes you don't do them.
Yeah, thanks. And so on that, if we had used the Likert scale, we would see some more gradations, right? And yeah, so other thoughts. It looks like Deb, you have your hand up.
Yeah, thank you so much. I think it was a couple of people right in the chat similarly that 90%. I think there's certain things that, yeah, could definitely answer it, but the 90%, is it 75? Is it 90? There are certain situations or certain people would come to mind to make you think, am I the clearest I should be there? So that was hard. It was hard. It's good.
Now let me see if I can go back for a second. Did somebody else have something to say about that? Let's go back to this slide for a second. So we've done a national study, and others have too, using this instrument. And every time it's done, not usually, every time at least that I have done this with in a study, the number one area that gets the most no's, or the lowest score, if you will. Anyone want to guess which one it is? It's on this page.
Is it related to the gossip?
Yes, awesome. Yes, number one. So the second most no's, or the second lowest score, let me go to the next slide, is on this slide, and see if anyone wants to take a stab at which one you think it is. Anyone have a guess?
I can see Andrew said number 14, speak directly to the person.
Andrew is absolutely right. That is absolutely right. And look how closely connected those are. So if we're gossiping and spreading rumors, we're not necessarily speaking directly to the person with whom we have an issue, do we? So those are really interesting and interrelated. Now, I know we don't have a lot of time, but I wanted to mention the true purpose, and maybe this came up for some of you as you were going through it. The true purpose of the index, and I've done this, and so it really does expose some of our vulnerabilities, and it takes some courage. But doing this with another colleague is how it's really intended to be done. So let's say that Nico and I work together, we're trusted colleagues, away from one another in quiet spaces, maybe at home, away from one another, the workplace. I'm going to do the civility index on my perceptions of myself, and I'm going to do it on my perceptions of Nico. Nico's going to do it on his perceptions of himself and his perceptions of me. And then we're going to come together and have a conversation and talk through our varying perceptions. I often suggest, and I've done this a lot with my students. In fact, I taught leadership for 20 years in a nursing program, in a baccalaureate program. And for years, my students and I would participate in this in dyads. I would ask them to do just as I described. And then as their professor, I would circulate the room and coach them on their ability to give and receive feedback in about the 9th or 10th week of their semester. Prior to that, I was helping them learn some of those skills that are needed to have those kinds of conversations, and also tying it to their nursing practice, which is you will be asked to provide feedback on colleagues. Doing that in a respectful way is going to position you well. So if you can do that with another colleague, it's really the intention of the index. Others have used it more as a 360, asking people to weigh in and providing them with feedback. So anyway, I better move along here, right? I'm looking at the time. So because I want to get to the pathway. And of course, my belief, certainly in that area of individual competencies, is really thinking about what we're role modeling. Are we demonstrating the kinds of behaviors that we want others to emulate? So let's talk about the pathway. I'm going to go through it pretty quickly. There are 8 steps, but I'm going to go really quick so you get a sense of them. And we'll have time at the end for a couple of questions. So the pathway for fostering organizational civility is a way of structuring if a workplace, a unit, a department, a school, makes that commitment to say, you know what, we're going to put effort and resources and attention into changing our workplace culture. So I developed this because I think it's important to have, not that it's linear, nothing's ever linear, right? It's very messy, but to at least have a structure or a framework for us to use as we move through this process. So the very first step, in my estimation, and what has proven to be true over and over and over, what for folks who have utilized the pathway, is that we really need to have leadership on board. And of course, I'm talking about leadership at all levels, but especially our executive leadership. So if you're in a school of nursing, we're talking deans, directors, provosts, and so forth. If we're in a practice environment, we're talking managers and directors and nurse execs. In other words, really having that leadership support, because not only do our leaders have often a much broader view, but having them on board for their influence and their ability to provide the kinds of resources that we're going to need to really transform the workplace culture. It's not that it can't be done without leadership, but it's an extremely heavy lift. So the second step of the pathway is we really need to measure what's going on. And I know that we do that, in academic settings with our campus climate surveys. We do that with our HCAPs. We have ways of measuring lots of different things in various settings. But I'm really thinking here about measurements, both qualitative, quantitative, so like focus groups, surveys, empirical measures, to really get to the heart of measuring workplace health. How are we communicating with one another in various modes and modalities? Are we resolving conflict? All of that really being gathered, including the other kinds of data that we might have, that will ultimately inform a step that I call the data-driven action plan, developing and implementing and evaluating a data-driven action plan. When we're measuring workplace health, I often suggest that if they're qualitative, say like focus groups, or if it's empirical measurements, making certain that the measurements you're using are also identifying your strengths and not just what's wrong. I've worked a lot in this business for over a couple of decades now, and when we're using instruments that only point out what's wrong, that can be really devastating. So how is it, how are we maximizing the things that make us special, that make us unique, that make us stand above the crowd? Because we want to capture those also in our plan. To do that, and having a committed group of trusted, empowered members of a team that come together. The very first team that I was ever on was probably back, oh gosh, it's been many, many years now. We called it an organizational design team. I worked with a group in Canada who called it the Spirit of Well-Being team because of their work with Indigenous folks. Whatever we call it, it's really that nucleus that doesn't do all the work, but their job is to really be dedicated to the mission, which is to advance the Healthy Workplace Initiative and to oversee, not do all the work again, but to oversee the implementation and evaluation, sometimes the development of the data-driven action plan, which is the next step of the pathway. In my experience, in my estimation, having this dedicated, very diverse of thought, diverse of position, discipline, all of that, having that kind of team that's high functioning is really the key to sustainability. We really don't want this to be a one and done. We want this to be something that exists and grows and continues to morph into something great. So because all of us are different, our data-driven action plan is going to have different parts of elements of it that are provided by a lot of the data that we've collected. But some of the things that I have discovered are on pretty much all action plans are really revisiting, and I'll bet you a lot of you have done this already, especially during COVID and post-COVID. What is our vision, mission? What are our values? Is it time to look at those? Do they still speak to what we represent? Or is it time for a refresh or a revise? And making certain that that is a shared vision, and I know I'm speaking to the choir here, of how we can make that available and glean input from all members of the organization to really craft that shared vision, mission, and other statements of shared values. Here's the thing that I absolutely believe with all my heart and soul, because a lot of people will say, hey, what's the secret sauce? What's the magic potion to creating a healthy work environment? And of course, it's messy and it's complicated and it's dynamic, and you all know that. But if you only do one thing, if a team or an organization only does one thing, this is what I would highly recommend. That we sit down as a team, all members, and really co-create, co-collaborate on putting a charter together about what our dedication is. Sometimes we call it a commitment to coworkers. We call it a charter. No matter what we call it, it's our commitment to how we're going to interact as a team. And it will include norms. And I brought a few examples forward. These are norms that, or team agreements, or behavioral rules of engagement, whatever you want to call them. But they're really well thought out and intentional to say, here's how we're going to interact with one another. And we're going to agree to these norms, and we'll hold self and others accountable to those norms. And I wanted to show you the next one because I'm kind of a fan of it. It's called the 10 Commandments of the ICU, or the Power of We. And I have permission to share this. These 10 Commandments, or the Power of We, were shared by a team in an ICU that was falling apart. They were not working well together. They were having all kinds of issues, including the impact on patient quality and so forth. They came together, and over time, because this takes time and thought, and put together the Power of We. And I know it's kind of small on your screen, but you see where they're saying, we're going to provide and receive constructive feedback in a professional manner. So that's kind of what I'm talking about when I talk about these norms of behavior, or our agreements with our coworkers. other things, and I'm going to go fast because I see the time, is we really need to pay attention to how we're building, resourcing our teams, because that's really going to be at the heart of how this work gets done. Paying attention to our skill building, particularly around issues of communication, conflict negotiation, and I know a lot of times people call them soft skills. I'm a hater of that term because what I like to call them in capital letters is power skills, because they are so difficult to hone and master because every situation is different. Next, really looking at our policies for hiring. Those will be great recruitment. When you put together an initiative for a healthy work environment, it really becomes a great recruitment and retention tool. Again, going quickly, making certain that you have a policy in place that is well defined and a step-by-step plan. You might recall on one of the slides when you asked people why didn't you address it, they said, I don't have a roadmap. I don't know what to do. I don't have a policy. I don't have a set of guidelines. I don't have these things. So making sure that we do. And then celebrating our short and long-term wins so that we can be building that momentum and going forward to build additional strength. And certainly I talked about this one earlier, but making certain that we're really taking care of ourselves. And I'm going to close with this quote. It's one of my favorites that says, in a world where you can be anything, be kind. So I want to thank you for your time today. I wish you every success. I know we have time for a few questions or comments, and I'm going to stop. Can you stop sharing for me, Nico, so I can see more people? So I'd love to hear your comments. You can chat them in. Nico's checking the box. Any thoughts, comments, good ideas?
Dr. Clark, I think it was absolutely wonderful, and I think it would be great for every organization to be able to really do some reflection and then put things into place. But I had a question for you, and I don't know if others on the call struggle with this, but now we are sort of a victim of patient incivility and patient bullying, and it's hard to, I mean, how do you navigate that, or what advice would you give us?
Yeah, so when I talk about policy, I really think that we need to be looking at our guidelines for that. And really having those well thought out, viewed by the lens of good thinkers from a legal perspective, from a behavioral health perspective, from our on-the-job perspective. And I know there's one in our state that I'm really impressed with, Kootenai Health, which is in Coeur d'Alene, in my state of Idaho, who have done a beautiful job of laying that out and then doing a full suite of education around how to prevent as well as address those situations. So I think it's going to be a real systemic lift. I really think it is.
Yeah. Thank you. No, that makes a lot of sense. I know some systems are starting to put into place some sort of rules, I guess, or guidelines, or whatever you want to call it, to the patient, and saying that, we're here to take care of you, respect you. We expect that in return, and sort of putting some guidelines forward.
Yeah, I just read a study. I can't remember. It's escaping me now. If it was Australia, Switzerland, I can't remember, darn it. But I just read it a few days ago where, and I think it was in Medscape maybe, where this study was done of patient and visitor aggression toward not the healthcare workers per se, but the reception workers, the
Mhm.
folks who are the front line and the abuse and things that those folks are taking. So this is a house-wide issue,
Yeah.
in my opinion.
Yeah. Thank you.
Yeah. Other thoughts? Maybe there's someone on the call that has put a program in place for something like that maybe wants to share that.
We don't have the program related to patients, but in our organization, we have done the team agreements and the stuff that you talked about related to that. And we revisit that every couple of years as a team related to that. And we're in the process of it now and looking at language around safe and brave and accountable spaces. Any recommendation you have related to that to ensure that we create a true space of belonging, which also includes civility? So any.
Yeah, so for me, what comes up is this whole notion of psychological safety. How do we create that? How do we overlay that onto a just culture, which I see very similar, those kinds of things. So the work of Amy Edmondson, if you're familiar with her work, I would also suggest that as you're reviewing that, be thinking about how you can use those agreements as a point, and maybe you already do, Deb, but a point of discussion when you're hiring people. Look, this is our commitment to one another. How do you see yourself in this kind of environment? And asking some of those open-ended questions. I think the thing that I didn't mention very well is this idea of tying what our expectations are into our performance evaluations. And I think that I know my colleagues, many of you in the practice environment, do that far better than my academic colleagues, because there's this sort of, and I think things hopefully are changing because it's this idea of academic freedom. And it's like, along with academic freedom comes academic responsibility. And so if there aren't teeth in a performance evaluation around these kinds of things, it's very difficult for people to, provide resources if some are needed, or supervision if that's needed as well. So I would really tie that, if you haven't already, into your performance evals.
Yeah, we've done that. We haven't actually taken the tool to our interviews, but I think that's a fascinating conversation. We do. It is embedded in our orientation and all of those kind of things for sure. But
have you seen it make a difference?
Yeah, I think it has shifted the culture. I think, it's just, things ebbs and flows, and the agreements are part of it, and how you keep it alive and how you make sure that people actually understand it. And you can do trainings on how you hold those conversations, but people still have to be in the space to hold them. So we make the agreement, but then with this one person, I'm not sure I want to have that. So there's fear with maybe certain people, and trying to do that across the team sometimes can be a challenge. So, but it's a journey, not a destination, just like everything. And
Yeah, I have such great respect for all of you. I really do. I mean that from the bottom of my heart. I think we might be over time, huh? I'm just so feel really privileged to be part of your night. And so thank you for inviting me. I appreciate it very much.
Thank you. It was lovely.
Yes,
What a pleasure
thank
to
you
do
so.
this.
Yeah, see you later.
All
Thank
right.
you
talk
so
to
much,
soon.
Dr. Clark. Thank you, everybody.
You're
We'll see
welcome.
you at
Thank
the
you.
hackathon.
thanks so much.
Yes, thank you.
Thank you.
Bye.
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 Bye.